two, one, two, three.
Hello and welcome to Ithaca DSA Presents. I'm Theresa Alt. I'm here today with Susan Beckley, a small business manager and a healthcare activist. It is the healthcare activist who will be speaking today about the New York Health Act. Susan Beckley, say a little bit about the New York Health Act, what it is.
The New York Act is a state bill. In the Senate, it's Bill 3425, and in the Assembly, it's 1466. This is a bill that would provide health care coverage for all New York State residents, regardless of age, ability to pay, or employment status. It will create a single public trust fund through which New York State will essentially pay the bills. It will pay for all covered health care costs with no copays, no deductibles, and no premiums. The bill has passed the Senate for years in a row and is backed by a majority of the New York State Senate and Assembly. The patients choose their own health care providers and cannot be denied coverage. No in and out of networks. It's all providers are in the network. All healthcare providers continue to be privately or publicly employed as they are now, including facilities and their employees. New York Health Act includes all medically necessary services and supplies, such as primary care services, preventative services, prescription drugs with no exclusions, specialists, hospitalizations, mental health. It includes dental, vision, and hearing, long-term care, home health care, and skilled nursing. Medically necessary supply costs such as walkers, prescription drugs, prescription eyeglasses, dentures, hearing aids, and wheelchairs are medically necessary supplies costs that would be covered. What's wrong with our current health care system? Well, we are in a healthcare crisis right now. On average, the United States, we pay more than twice as much for healthcare costs as other nations that have universal healthcare coverage for all of their citizens. Two-thirds of our bankruptcies in this country are due to medical debt, which really impacts people's credit scores. And most had insurance at the time of bankruptcy. But the copays, deductibles, out of network charges are just throwing people into bankruptcy. We have a lower life expectancy. That gap is growing from 4 years between the lowest 25% of income earners to the top 25% of income earners to it was 4 years. Now it's 13 years between the life expectancy of the lowest 25% of income earners and the highest 25% of income earners in this country. This is probably due to like the unfair distribution of accessibility, which is affordability through rationing, because people often don't go to the doctor because they can't afford it, certainly if they don't have insurance at all. And availability, location of where you can get to a facility should you need to see a doctor or go to a facility. And we have worse healthcare outcomes for diabetes, heart attack mortality. We have higher infant and maternal mortality rates. And on top of it all, we go to the doctor less than most countries that do have universal health care coverage.
Yeah, I was going to say, and I think there are some special things happening just now,
Oh, yes.
now more than ever.
Right. Well, we have the, Affordable Care Act, which, reformed the prior program, but it doesn't control rising costs. That's a federal program, and the ACA is 11,000 pages long. It's just in so complex and convoluted. And the New York Health Act is only 29 pages long and identifies what would be covered and its mission and how it would go about being covered. Right now, we're in a crisis due to essential plan reductions for New York State. As of July 1st of this year, 470,000 adult New Yorkers will lose their health care coverage due to cutbacks from Medicaid from the federal government. So that'll be 470,000 adults that are going to need either have to pay for health care themselves out of pocket or find some other form of insurance to pay for their health care coverage. With that Medicaid federal reductions beginning July 1st, it has put a variety of local hospitals at risk of closing. A variety of rural hospitals have a large Medicaid population. So, right now, with these cuts, the hospitals at risk in this area include Guthrie Cortland Medical in Cortland, New York, the Krause Hospital in Syracuse, Arnott Ogden Medical Complex in Elmira. That's a tertiary care hospital, which means that it has a neonatal unit. It takes trauma patients. That's at risk of closing. And also Schuyler Hospital in Montour Falls in Schuyler County. Now, people may be saying, oh, well, that's not in my county, so I'm okay. Well, when these hospitals close, all of those citizens that, or residents, I should say, that would be going to those hospitals have to find another place to go. And their physicians have to find another place to send them, which means they will be coming and overburdening the other facilities all around. Plus, all of those people who were employed by the hospitals will lose their jobs. And in these rural areas, that could be really problematic.
I think you partly, but perhaps not entirely, covered why we are looking for state legislation rather than a change in national legislation.
Correct. The New York Health Act is to be implemented as soon as it passes. Since it is a much smaller bill and not covering 50 states like the ACA, it should be much more modest with focusing on this single plan because the ACA had to take into account all the different insurances and all of the different plans. The New York Health Act does not have different plans. Everybody's covered, everything medically necessary, be it services or durable medical goods. That being said, we don't have couples coverage and family coverage and individual coverage. We don't have all of these bronze and silver and gold plans and all of that. It's a single plan that is paid out of Albany directly to the providers. So it takes out all of that billing and the consequences of all of that. We have a variety of savings this way. We have no agents and brokers fees. We have no high administrative costs, which can be up to 30% for private insurance. Medicare is like 3 or 4% of overhead, much more streamlined in that regard. There's no prior approval for health care, no out of network costs, no dividend payouts to shareholders, no drug costs that are not negotiated. The state will negotiate as a single entity with the drug companies in order to lower drug costs. And there are, of course, no enormous CEO and upper management salaries, stock options, bonuses, and all of that. We will have no yearly health insurance plan negotiations. I mean, we all have to look at health insurance on an annual basis, including employers as well as providers. Providers have to decide what plans they're going to participate with and which ones they won't. All licensed physicians and licensed medical professionals in the state, which is identified in the bill that you have to be licensed in the state, will be able to provide medical care without having to decide which plans to participate with. There'll be no open enrollment for Medicare recipients, employers or employees, and no marketplace. It will eliminate endless paperwork for recipients and providers because there's one plan, and prevent large premium increases and control costs, which currently double every 8 years. So there are a variety of sample economic studies that have been done. The most recent one has been in 2024 with the economist Leonard Rodberg. And as an example, if you were earning $100,000 a year and you were to pay for the entire cost of this plan, you would be paying less than $500 a month. And everybody in your family would be covered and for all medical needs. Now, if you're employed and have an employer, it's stipulated in the bill that that employer would be responsible for paying 80% of that payroll tax, and the employee would be paying 20%. So, if you're earning $100,000 and you're employed, you're still paying less than $100 a month for your health insurance coverage, which covers everybody in your family and all of your neighbors and everyone else. So it is really quite a modest amount compared to what plans are charging now. There is no profit in a public coverage system.
Right. No profit, and I think also no advertising that
Uh,
says choose this plan, choose that plan, choose the other plan.
Correct. And you don't have agents and their fees, but in addition to that, you can't prohibit a insurance company from offering insurance. The thing is that this being legislation, it will require payments into the system from a payroll tax and a non-payroll tax on taxable income into the New York Trust Fund. If an insurance company wants to offer coverage, first of all, they would have it stipulated in the bill that the coverage would have to be at least what the New York Health Act covers. There's no plans that we know of that cover comprehensively and universally like the New York Health Act. So it wouldn't be, quote, profitable for any insurance company to try to do that because they wouldn't make any money. And you're already paying out of payroll like you do when you pay your Medicare taxes out of your pay currently. You would have this for the New York Health Act additionally, and that's how the New York Health Act would be paid for. Currently, the amount of medical expenses for all of New York State is covered by a little over 48% by federal funds. So that's Medicare, Medicaid, the CHIPS program, which is Child Health Insurance Plus, and miscellaneous other federal programs that come in to pay our medical expenses as they stand now. You can see the New York Health Act is sort of a wraparound with it, paying that other 50+% out of payroll and non-payroll taxes. The first $25,000 of somebody's salary is exempt. So if you earn $25,000, you do not make a contribution, nor does your employer. If you earn $30,000, you would be paying on the $5,000 worth of income above that. One way to look at it is that if you were making $41,000 and you were employed, that would come to less than $18 a month out of your pay. You will have no copays, no deductibles, no premiums. So this is a pretty good deal.
Right, a lot cheaper than what we have now.
Absolutely.
And I've myself witnessed how crazy the billing can be. A few years ago, I got a bill for $7.50.
Okay.
That's what was, calculated. I'm on
Uh-huh.
Medicare, and
Yep.
that's what was calculated after
Yeah.
whatever they paid. And I looked at it and I said, well, this must cost the hospital a lot, or doctor's office, a lot more to send the bill and then deposit the check than it ever
Absolutely.
collected.
Yeah. Yeah. Uh,
The
and,
a crazy experience this year is that I kept getting online notices that a payment of about $200 was overdue. Did I need financial help?
yeah.
But
Yeah.
finally, I got through to a human being in the system and
Uh-huh.
explained that the problem was not that I needed financial help, but that I had not received a bill.
Yes. And all of this would be taken care of through Albany and the New York Trust Fund. So, one of the beautiful things about this bill, there's no balance billing. You will not see a bill. It's all done between the physician's office or the facility and Albany. Duke University has something like 1,600 billing agents for a complex of hospitals that is a less than 1,000 beds, something like 950 something beds. They have 1,600 billing agents. University of Toronto has something like 584 beds, and they have either 5 or 7 billing clerks. So there's a substantial savings in regards to how efficiencies will make all the difference. In Canada, when the bills go from the various provinces to Ottawa to be paid out, they're directly deposited to the bank accounts. There's no checks. You get a readout of what the charges are. You send it electronically, and the payment goes electronically to your bank account.
It sounds like a lot of clerical employees, both in medical offices and hospitals and also in insurance companies, will lose their jobs. What happens to them?
In the bill, which is specified there, there is a 2 years of training that will be provided for people training for other professions. Certainly, I worked as a medical office manager a number of years ago, and I've done medical billing myself. And with that, these types of jobs, doing billing, reconciling accounts, and that sort of thing, are jobs that are pretty much in demand, certainly by small businesses. I mean, so many small businesses need clerical help. But in addition to that, this bill also specifies that people are eligible for 2 years of unemployment, which currently you're eligible for 26 weeks. But in the event that people are losing their jobs through no fault of their own, that is specified in the bill to extend those unemployment insurance payments for the 2 years so people can have a dependable income and also can retrain. But you know what, Teresa? They're still insured. They have health
That's,
insurance.
well, that'll be a change for unemployed people.
Exactly. And it's a big thing for the gig economy. I mean, I have, kids who tended bar, and, there are people who are artists, who are writers, who are musicians, who like have a couple of part-time jobs and or have contractual work, that type of thing. I've worked for contractors doing their books, and they oftentimes can't even afford insurance for themselves. And so, with this, they and their employees will be covered. The school districts, the budgets for the county and the city and various municipalities will know what their expenditures are. It's not going to be a surprise that your premiums just went up 15% and your employer is going to drop coverage from a gold plan to a bronze plan because that's all they can afford. And now you have a $10,000 deductible instead of a $600 deductible. This is at the whim and the we're at the mercy of the insurance companies with this.
It would have meant a lot for me a few decades ago
Absolutely.
when I decided I had to completely give up the skilled work
Yeah.
that I had trained for
Uh-huh.
because I wasn't finding a regular job in it and go work as a secretary for the health insurance that I would get.
And absolutely, a lot of people who getting health insurance for their job are sort of like chained to the desk because I know a variety of people because of the health insurance they can get with an employer, can't leave their job because that policy covers their family members. And so, if somebody wants to start their own business, you can't afford health insurance. This will liberate so many people in order to start jobs and don't have to worry about if their kid gets sick that they can't take them to the hospital. All of that anxiety and strife, not to mention, I mean, I just cannot fathom what a parent would go through if they had a child, say, that had leukemia, bankrupting yourself while you're going through the anxiety and worry and all the rest of it with that child and having these medical expenses, let alone if it goes out of network because the child needs to go to the Mayo Clinic or Boston Children's Hospital who are not in your network. I mean, this will relieve people of so much grief and anxiety by just having a predictable payroll tax that the more you earn, the greater the contribution. But as we can see, it's fairly low. And the other part is that non payroll income that's taxable is also taxed, and that provides a large chunk of that balance that the federal government is not covering. It's the non-payroll income that's taxable is like capital gains, dividends, interest income, and that's the a large amount of taxable income that would go and contribute to the New York Trust Fund to pay for the medical costs.
Oh, great.
Yeah.
And I understand there are some special advantages for New York counties and cities.
Again, it has to do certainly there's a Medicaid mandate on all of the counties in this state. New York is unique in that fashion. We get 50% of our Medicaid funds from the federal government, a lot of which is being cut right now, 25% from the state, and uniquely for New York State, each county provides the other 25% for their county recipients. Those local savings, that Medicaid mandate that we have to contribute as a county, which is based on property taxes, goes back to Albany. And in Tompkins County, it will save over 21% of the budget. It'd be $12.3 million that we don't have to pay out of our budget for Medicaid,
Out of our property taxes.
which are paid by property taxes.
Yeah.
Tompkins County employees, Ithaca City employees, we pay currently all of the health insurance costs. We pay all the school district employees costs. And, with that, it ranges from 10, 21, 12, 23%. New York, Ithaca City School District employees, we would save 23% of that budget that we're about to vote on. 23% of that budget. And this is with everybody being insured. It's not just like taking away their health care. This includes them being covered by the New York Health Act, their families, everybody else, part-time, full-time, whatever, all paid, and we would save what I have, 30 $39 million out of the Ithaca School District budget. That's outrageous.
Yeah.
I mean,
Well, I hear there's also an advantage for unions.
oh, absolutely, because the piece for unions is that you take the health negotiations off the table. Everybody's insured. So people are, again, not bound to their job, but you can now negotiate for staffing, for better wages, for better benefits, pensions, paid time off, negotiate for maternity leave. Any of that stuff. Now you can negotiate with those, and you will have your health insurance coverage still covered.
In any case. Okay,
Regardless.
and when could these bills be passed?
Well, the bill is both in both health committees, which are current representatives, Assemblywoman Anna Kellis and Senator Lee Webb, are both on the health committees. The bills are there. They need to come out of those respective committees and come to the floor for a vote, and a debate and a vote. But it's finished legislation. It passed in the late 20 teens with 4 years in a row from the Assembly. It did come out at that time, but it's not come out since.
Thank you, Susan Beckley, for giving us the lowdown on the New York Health Act. This has been Ithaca DSA Presents. I'm Theresa Alt. Thanks for watching.
1, 2, 1, 2, 3.